I know I feel like it's romper room. I see Neil and I see Pamela. See my Georgia folks. Hi, Atlanta. You'll notice on the screen and obviously in the chat also we have a question for you. So please chime into the chat to answer the question if you can.
Somebody is typing ferociously, so
Very aggressively.
reminder to I can certainly mute them, but
They're making sure that it goes in the chat. They're answering the questions in the chat.
All right, welcome everyone. We're very excited to see you all today. Just like our colleague dropped in the chat, if you don't mind just answering how you've most effectively learned new concepts in the past. We're going to come back to this later in the presentation. I'm just going to give everyone a moment to sign on. Thanks for joining us. And in case anyone needs any elaboration on this question, although I see plenty of answers in the chat already, thinking back on your past training experiences or other learning environments that you thought were particularly effective. What about it was so effective? Were you in a group? Were you using self-guided resources by yourself? Was your facilitator doing something particularly effective? Great. Lots of answers here. Thanks. All right, we're going to make maybe one more minute to allow folks to log on, and then we'll go ahead and get started. All right, I'm seeing a lot of great answers here, writing things down, hands-on learning, handouts, right? Practical experiences are being shared. Making it fun. Neil, I see you. Hello, welcome back. All right, again, for those who are just joining us on the call, we're asking folks to share in the chat how you've answering the question in the prompt here. How have you most effectively learned new concepts in the past? We're going to come back to this in a few slides, but I wanted to get our brains moving. Thanks for joining us. We're very excited to see everyone logging on, both from our Ryan White funded sites as well as some of the POs. I recognize a few faces. All right, well, it's 6 minutes past the hour. I think we could go ahead and get started. Our colleague will continue to just drop that prompt in the chat for those of us who log on. But Brittany, do you think you could advance to our next slide? Great, thank you. All right, welcome everyone to the official orientation to our CARE Collaborative. This is an 18-month quality improvement initiative managed by the Center for Quality Improvement and Innovation, or CQII, as we are lovingly known, especially for those of us for those of you that aren't familiar with us yet. My name is Megan. My pronouns are she, her. I'm the director of CQII. I've worked in various Ryan White spaces for a little over a decade now, and I'm very much looking forward to getting to know the sites who are new to us over the next few months and the work that you're already doing, as well as working again with those of you who have worked with us in the past. Again, I already see some familiar names and faces, so it's great to see you again. I do have a small ask of you all. If you could please turn on your cameras if you're able, in an area to do so. We're here to get to know each other today, so I'd like to start putting some names with faces if we can. And there will be a lot of information presented to you over the next 90 minutes, but I want to emphasize that you do not need to memorize all or any of this. The slides will be shared with you as a resource to reference after the call, and our purpose today really is to give an overview of the program and our goals, but also just to tell you what the next few weeks will look like as a participant in the learning collaborative. This is also meant to be a participatory space as we were trying to promote while you all were logging on and giving us some of your ideas already. So please, drop a question in the chat if you need clarification on anything. Feel free to also just unmute and say something, or again, just drop it in the chat. We'll have staff monitoring that. All right, can we go on to our next slide? Thanks, Brittany. So why are we here and what do we hope you all gain by the end of today? First, we'll share who CQI is to those who are new to us and a little about our history of facilitating learning collaboratives. We're going to talk about the rationale behind this learning collaborative and its focus on retention and linkage to care that we've discussed at length during our recruitment calls, but as reminders. We'll also discuss the resources that you'll use throughout the collaborative and how to access them, especially over these first few weeks. We'll go over what to prepare for your first QI coaching calls, what to bring, who you'll meet, and who will organize the logistics of those. What to prepare for your first learning session as well at the end of May at the HRSA headquarters in Rockville, Maryland. And then finally, we'll go over next steps after this call, and again, what the next 6 to 8 weeks look like for all of us. All right, next slide, please. Thanks, Brittany. Again, so who is CQII? We are funded by HRSA to provide technical assistance around QI to Ryan White funded recipients around the country. And this ranges from a number of things. So first, we create and disseminate QI resources to build the QI capacity of Ryan White sites. We host virtual and in-person trainings around various QI topics and concepts. I know a number of you are already familiar with them. And again, happy to see some familiar faces. And finally, if you look on the far right there, the top corner, this is where our learning collaborative lies. It's one of our communities of learning where we work collaboratively with others who promote QI to learn new QI methods, impart our experiences, and learn from one another. Thanks. You can go to the next slide.
Megan, there's a
Megan,
comment
we have a question.
by Tammy.
Oh, sorry. Yes, please bring it to my attention. I'm having a hard time looking at the, go ahead.
Sorry, this is
Yeah.
Tammy and Natty, and I can't see the slides. I can see everyone's names and the faces of people that are on there, but we can't see the slides.
Oh, no. Okay.
I don't know if we're demented, which it could be.
We can see the slides.
That's what I'm
Okay.
saying.
Tammy,
I'm
could it be
worried.
the view that you have that you're looking at? Maybe it's the view that's not allowing you to see the
Yes, let me
slides.
see here. Hold on. So it says speaker gallery, multi-speaker.
At the top
Usually
of
on the
your
upper right corner, this says view, and there is it should be on standard because that gives you the slides.
Hit the view one, Tammy.
Or she could do the side-by-side gallery if the standard is not available.
I'm
That's the
so
one I
sorry,
have to use. That works.
but mine doesn't say that, and I know this sounds crazy. I have speaker gallery, multi-speaker. I wonder if I can exit full
Try
screen.
speaker gallery. And it may be an update to your actual technology. When you go to speaker gallery, do you see the slides now?
No, I just see everybody's faces.
Oh,
How about
Oh.
this, Tammy? I will send you a few screenshots of what I do, and hopefully it works out for you. We will send you if you send
Thank you.
me I will send you in an email. I put my email address in there. If you send me yours, I will send you the slides so you can follow along in
I
a kind of
appreciate
a different way, but the probably the best way. Tammy, I
You
will
send it
send
as a
out my
PDF.
email.
I was going to say, if someone wants to download a PDF for Tammy too and email it to her, and it's not quite as effective, I know, as seeing the same thing that we're seeing at exactly the same time, but at least you'll be able to kind of scroll through and follow along if it doesn't work out. All right. Sorry about that, Tammy. Sorry you're stuck with our faces. Okay. So again, I wanted to bring us back to this first question. How have you most effectively learned new concepts in the past? And if you think back again on past training or learning spaces, what was so effective about it? Would anyone dare to unmute and share verbally, or maybe again copy and paste what it is that you dropped in the chat? You'll get brownie points for being first.
I'll go.
Oh, Janessa, hello, go for it.
Everybody. Janessa, she, her. I said I'm very visual and I'm very hands-on, and I think it's pretty 50-50. So I'm like, let me see it and then let me do it. Like, let me get in there.
Similar. So making it practical, trying it yourself, experiential learning. Great. Anyone else?
I feel the same. I think that relating it to real world experiences is the best way that I learn. I have a couple of staff in here with me. They're saying that they are very visual also, and so seeing it and hands-on training as well.
Great, great. Similar for myself. All right. Anyone else? And when you unmute to answer, mind just saying your first name and where you're from, where you're dialing in from. That'd be great.
Hi, Cora, and I'm from Asheville. One of the things that I think I'm a hands-on person as well, but as someone with ADHD, an engaging learning session is really important, not just like narrating on the screen, keeping it in a way that holds attention and is engaging, and then on to have those more hands-on opportunity discussions of the material I found is really helpful.
Right. You broke up a little bit there, Cora, but what I heard was essentially facilitation is really important and how the information is communicated, making it engaging, making it practical, and not just, we're not here to sit in a college classroom necessarily. Not everything has to be didactic. Right. All right. Anyone else? One more time before we move on. Or Andrea, did anyone say anything in the chat that you think was worthy of shouting out?
Hi.
Oh, Erica. Hi. Hello. Go ahead.
Yes. So I added in the chat, but I can just bring a little bit more light to it. As a former Peace Corps volunteer and learning a different language, immersion was really good. And in a professional setting, I always enjoy interactive work groups, having the opportunity to ask questions of those who may have a different perspective, as you learn and implement.
I am also a former Peace Corps volunteer. I was in Lesotho for a number of years, so welcome, our PCVs.
Yeah.
So essentially there really is no substitute for being in the space, right? So applying these things in your administrative or care settings, in Ryan White settings, and seeing what that looks like and trying them out. So I think we wanted to bring this up because the Learning Collaborative really strives to promote most of what you all are suggesting here, Speaking from experiences in past collaboratives, there's shared responsibility, harnessing the strengths of your other QI team members. There's opportunities to collaborate with other care sites with similar barriers and facilitators to care that you might otherwise never meet. We also realize that you all are adults with self-direction and lots of life experience. And we want to harness that experience and strive to make our content as relevant and practical as possible, like you all have already mentioned. So this is where both CQI and your QI coaches that you'll meet kind of throughout the presentation today will guide you and play a big role, as well as just generally work with you and again, harness that experience that you already have. So I do want to mention that there is opportunity for all learning styles to engage in the content of the collaborative. So even if group learning is not your favorite or your style, we will continuously provide resources that team members can take, study on their own, digest, and then discuss with their teams or their coaches if they've got questions. So we're always here as a resource. Okay, why don't we go to the next slide? Great. So just to revisit, those of you who haven't participated in a learning collaborative before, learning collaboratives bring together organizations with common goals like yourselves to study and improve upon a specific topic area. And like we mentioned today and during your recruitment calls, we'll be focusing broadly on, linkage, retention, patient care experiences, and improving all of those. So we'll again be providing guidance and tailored QI coaching throughout each stage of the collaborative, just to reassure everyone here that you don't need to do this all on your own. And then let's see, next slide, Brittany, if you don't mind. Great. All right, I'm going to pass it over to our PI on this project, Clements. Do you want to introduce yourself?
Thank you, Megan, and a warm welcome to all of you. Thanks for joining, and it's an exciting new milestone for all of us to engage in this new care collaborative. So a warm welcome to all of you. I'm Clement Steinberg. I'm the principal investigator for CQII and for the last 20 plus years. So it's nice to see so many familiar faces, and a warm welcome to those who are potentially new and first timers in our collaborative learning model. Next slide, please. So in this care collaborative, we have a long history. In fact, this is our 10th plus collaborative that we are doing together, and we developed multiple guides based on the experience. We published multiple papers. So I want to make you aware that this is really something that we have done before. And how about this? I see so many familiar names. So how about in the chat, if you put in like, which collaborative have you participated in? In the meantime, I will get going. But I wanted to just, again, a warm welcome to all of you who participated before and those who are new. But put in the chat which name of the collaborative participated in, and for some, it may actually be more than one. Next slide, please. I wanted to highlight very quickly on our last collaborative, which was called Impact Now Collaborative. It was basically focusing based on an invitation-only approach for recruitment, and it was really about increasing virus suppression rates. And we recruited sites that had the highest potential for national impact, and that really gathered our 23 sites that really for the last 18 months over the course from 2023 to 24 worked together and made a difference. Next slide. We were able to actually demonstrate not only that participation in the collaborative correlated with improvements for your patients. So I want to highlight that point that active participation in our collaboratives, including the Impact Now, was correlated with improved health outcomes. It's important to note that all the investment that you do will benefit your patients. You see here that our improvement rate, the virus suppression rates for about 50,000 patients that we reported by our 23 sites, improved about 3+ percentage points. You know, and sometimes we think like, well, 3% doesn't sound a lot. But I just wanted to note that we actually were able to have 1,800 additionally viral suppressed patients. And I always get the question, so what does that mean? About 1,800 additionally virus suppressed patient means that we were able to avert about 188 new HIV transmissions. We also were saving about $82 million in healthcare costs. So thanks for those who participated, and I think we have hopeful another potential here to make another national impact with this new collaborative. Next slide, please. The next slide gives you some of the quotes that came from our evaluation approach, and we actually had, we worked with the University of California, UCSF, Dr. Wayne Stewart, and they conducted a lot of different qualitative interviews. I probably want to highlight the first one, and I read it out loud for Tammy and others. I feel so energized at the end of this collaborative, and I feel like I was really successful and I feel joyful about it. I also want to highlight the last point here that a quote, and it came from our coaches, is trust yourself and trust the process. And I want to make this point. This feels today maybe very overwhelming. And oh my God, we're going to jump to conclusions, solutions. We have to do something tomorrow. This is a marathon, not a sprint. Trust the process. We have done this before. Trust our coaches, and they will help you along the way. With that, we're going to turn on to the next slide. And I think, Alana, I hope your internet is working well. And let me know if you get into troubles with the internet.
Let me know if I sound like a robot. I think it's working better.
Works
If
perfect.
not, if it's acts up in between, I'll just call in. But hello, everyone. My name is Alana Lewis Cherry. My pronouns are she and her. I am the program manager here over at CQII. I've met some of you on many of those individual one-on-one calls as you shared some of the amazing work and innovative ideas you're doing around linkage, retention, and making sure that your patients are involved in their care. So I'll talk a little bit about the Care Collaborative background. You heard some of it, but we'll get a little more in depth. If we can jump over to the next slide, Brittany, that'd be helpful. So you've heard that this is the 18th month journey. Clemens mentioned this is a marathon. This is not a sprint. We have looking to bring together collaboratives, Ryan White participants and sub-recipients similar to yourself. That's across the United States. So if you see you'll see throughout the day that we have sites that are represented from many other states, so that you all can see what's happening with the work across the U.S. We will be promoting quality improvement applications to measurably improve the health outcomes for those patients who are out of care, focusing primarily on those who are newly diagnosed with HIV, as well as those, those who are newly diagnosed with HIV but not linked to care, and those who are out of care, but we want to bring them back into ongoing HIV care, so retained in care. I think if you all recall from some of our one-on-one calls, we really want to foster this collaborative around a patient-centered approach, focus on their healthcare experiences for those patients who are out of care, and meaningfully engaging people who are living with HIV into our QI efforts as we work to implement and do the work together. Next slide. Now, in terms of the goals, some of it if you all remember that data slide we shared on those one-on-one calls, we kind of focused on these are some of the goals. We have clinical improvements as well as process improvements, which I'll get to the next slide. But for our clinical improvement goals, we want to focus on linkage, retention, and viral suppression. And when we mentioned that data slide from the one-on-one calls, we mentioned that we were looking at to bring your site to the national mean, whether that was for linkage and retention. For linkage, we were looking to bring you to For linkage, we were looking to bring you to the national mean, to about 80% or 5% from the baseline of what your numbers are, whichever was higher. For retention, we mentioned we were trying to bring you to the national mean, which is about 78% or 5% for your baseline or higher. And then in terms of viral suppression, we were trying to bring you to the national mean, which was about 90% or your up to 5% baseline or higher. Now, in linkage, I mentioned we're looking to increase the number of people who are newly diagnosed with HIV, but not seen by a prescribing HIV care provider within 30 days of being diagnosed. And then retention, we're talking about those patients who have not had at least 2 HIV medical care encounters at least 90 days apart within the measurement period. And lastly, virally suppressed, we're looking to bring those patients who are to increase their viral load to bring their viral load to less than 200 copies. I'm over here tripping over my words, but that's okay. We're going to go over to the next slide, and that's the process improvement. So the process improvements is where we're kind of really focusing on those patient-centered approach. We're looking at those tests of change, your team compositions, how people with HIV are involved in the QI activities, as well as their patient experience. So in terms of the tests of change, we want to make sure that 90% of you who participate within this collaborative have documented at least one test of change in the driver diagram, which we all will be introduced to once we get to the learning collaborative in-person learning session. So in terms of the team composition, also, again, we want to make sure that 90% of the sites that are participating in this care collaborative have at least one person with lived experience who is actively participating in their local QI team. We also want to make sure 90% of you improve your involvement of people who are living with HIV in these QI activities. There will be some standard measurement assessment tools that you'll be utilizing within the space. We want to make sure that we kind of measure how the personal lived experience is really brought into the space and involved into the space. And lastly, measure their experience. Measure how we want to make sure that 90%, again, I think 90 is our lucky number, but we want to make sure 90% of the teams implement at least a patient experience measure to improve the experience of people who are newly diagnosed, and we're linking them to care, as well as those we're re-engaging back into care. We can jump over to the next slide. So this one, again, reiterating that those HRSA definitions for linkage. We want to make sure a patient is linked to care when they see a medical provider after being diagnosed within 30 days. In terms of retention, we want to ensure, yes, Deontay, I see your chat that popped up, aligning with EHE goals. For retention and care, we want to make sure, regardless of age, a patient has at least two medical encounters, which means one is by a medical provider, a medical provider prescribing privilege, as well as at least a viral load test. And at close, we want that to make sure at least 90 days apart within a 12-month measuring period. We can jump over to the next slide. And this slide, we kind of just want to bring in some numbers here. If we bring about 1,000 people with HIV who are currently out of care back into HIV medical care and help them to reach viral suppression within this 18-month collaborative, we're estimating that we would avert about 105 HIV transmissions, saving the healthcare system quite a lot of money. So we want to make sure within this collaborative, we want to bring in and see how we can really improve the care for participants. And the next slide, again, is a little bit of data, but we want to look at it geographically on the map, right? What percentage of our patient population is not linked to care by state? And again, we mentioned we're looking at all white providers across the United States. So as you look on the map, you may see that your site is here or your state is here. When we're looking at the dark purple dots on the screen, we're seeing that maybe 20% of the 20% or more of patients within that area are not linked to care. When you get to the yellow dots, you see those numbers go down a little bit more. But we want to kind of drop in the chat. what state are you representing here? Do you see your state on the screen as one of the states that we want to continue to align with the work that you're doing in terms of linking your patients to care? Come on. And I let me see if I remember this, Andrea. Help me out. I remember from the one-on-one calls. I don't know if I have any Ohio sites. So what do I say when it's Ohio is OH and what is it?
Then they have to say IO. So
Come
you
on.
just
So I
say the
hope there's some
OH.
Ohio sites. I don't think
There,
Ohio's on this list,
Bijay
but
did it in
I
the
said I was
chat.
gonna say that. Yes.
IO.
Thank you. Come on,
IO.
Ohio. Um, next slide. But yeah, we have a see if you pay attention to the chat, you see that there's many other Ryan White's providers similar to yourself that's represented in the space. We know that you all are doing amazing work around retention and linkage as well as involving your patients. And this collaborative, we want to continue to align with that and support you in the work that you're already doing. I see Maryland, Georgia. Welcome, Georgia, Arizona, Texas. All right. Now, for this next slide, again, just a little bit talk through as we were kind of deciding what we wanted to really own in on this collaborative. We did some literature review and found that, overall, individuals who are not retaining their HIV medical care, they were 2 times more likely to report being somewhat or very dissatisfied with their prior HIV medical care provider. So this is why we really want to bring in the patient voices within this space. We've seen that individuals who are not retained in care, they require more mental health services compared 2 times the rate higher than those who are in care. So we kind of want to understand what's happening with your mental health for those who are out of care. What's happening so we can work to bring you back into the space. And then we also lastly see that oftentimes individuals who are not retained in care is 2 times more likely to have financial constraints or lack of insurances. So within this, and then these are not new things that I'm sure many of you are doing the work, so you're familiar within these spaces. So this collaborative really want to own in on these things. How can we work through some of these challenges that we see that patients are having who are out of care as we work to bring them back into care? And I believe that's it for me. I'm gonna share it over to turn it over to Megan to kind of focus on some of the collaborative details for you all.
Yeah. Okay. Thanks, everyone. So we'll share some timelines now and other details about the collaborative with you all. Next slide, Brittany. Thanks. So the box highlighted in red here is what we'll be focusing on most today. Again, just preparing you for your first coaching sessions that CQII will help you schedule throughout the remainder of April and May in anticipation of learning session 1 on May 29th and 30th. There's a little bit of pre-work in there, but we will guide you through that as well and provide templates and instructions, and we'll get into details about that in a minute. But first, we wanted to share some background and rationale, as well as just a general time commitment. Do you mind going to the next slide, Brittany? Thanks. So this attempts to break down and give you a sense of the time commitment per month. We did chat about this during some of your recruitment calls, and others who are part of other learning collaboratives are generally familiar, but every month you'll have QI coaching sessions. So you'll individually meet with your coach, just your site and your coach, and then another with a group of other Ryan White sites that you will learn from and share with. So we also expect you all to participate and prepare for learning sessions every 4 months. Present using our provided templates, which we will also get into detail about in a moment. And we'll alternate between in-person virtual learning sessions and virtual learning sessions. And generally, our learning sessions are at HRSA headquarters, if they as long as they have space for us. So we also submit performance data, linkage and retention data every other month via a database that we'll share more details about shortly. And then we have a number of affinity groups that will start meeting this summer, and they meet about quarterly as well. These aren't mandatory. They are for specific groups of folks, but most are welcome. So we'll go over details about that in a moment. Go to the next slide. Great. All right, I'm going to pass it over to my colleague, Andrea, who will introduce herself as well.
Hey, y'all. So I am Andrea Mayer. I use she, her pronouns. I am one of the senior program coordinators here at CQII. For those of you who participated in Impact Now, you know me from there, or Learning Lab, you might know me from there. And yes, you can see we've been talking a lot at you, and y'all have been great about chiming in the chat, but we'd love to get into a little bit of conversation now. We know there are different types of folks in the room. We have direct recipients who implement, and we have recipients with sub-recipients who implement. So we just wanted to kind of unpack that a little bit now. I'm actually going to ask, I know that the questions are up here for y'all to see. I know a lot of folks mentioned they like things visually as well. So I did want to leave it up for a little bit. But I'm going to ask Brittany to go ahead and take down the slide so that we can have a little conversation. And I'll put the first question in the chat. So the first question was, in what ways could recipients support their subrecipients participating in the collaborative? That's the way we phrased it. I know there are some recipients of subrecipients in the room. I said hi to one of them right off the bat, and I saw another one sign in. I don't want to name check anyone, but we'd love to hear from you. Whether you are the recipient or the subrecipient, in what ways do you think that recipients can kind of support their subrecipients to participate in the collaborative? Who would like to be brave and unmute and speak, or certainly you can type it in the chat if you'd like. Oh, I just saw another person who might have just picked up a cat, I think. Oh, they know. They know who I'm talking about.
You all feel free to, drop your answers in the chat as well, and we can read them if you don't want to unmute.
Hi, can y'all hear me?
Yes.
Perfect. So this is Delana from University Health, Texas, Fax Clinic. One way that the recipient could support the subrecipients is through data.
Thanks, Delana. That's great. Do you want to expand more? I don't want to put you on the spot too much, but how do you think they could help do that?
Well, at least with our recipients, our AA, they house a lot of the data components that are already broken down for us. We just recently transitioned to a new EMR in the last, I say recently because it's taken some time to integrate and figure out all of its capabilities. And so for us, we're haven't quite figured out the right and white platforms in our EMR system. And so our recipients, our AAs have the capability of crunching those linkage to care retention and receipt of care for us.
Thanks so much, Delana. I see smiling faces and nodding heads. I know personally of several folks who've mentioned they have transitioned EMRs. So you have many friends here in this space who can share their experience on that front.
Andrea, we have a few questions
Yeah,
we
I
have
saw
one
Neil in
question
the
in the chat
chat.
box.
I saw Nellie in the chat. Yeah, I just meant, sorry, I just noticed that one. So just to read out the question for anyone who can't see it in the chat, my coworker and I are new in this collaborative initiative. What's the difference between recipient and subrecipient? This is, you may have noticed already, we kind of refer to you all as sites to get away from this recipient, subrecipient language. So there are recipients, when we say recipient, we mean of Ryan White HIV/AIDS program funding from HRSA. So everyone here receives those funds, but some folks who are a recipient directly implement those services. So they might receive Part C or D funding, and they see patients directly and provide that care. And then there's some like Part A's and Part B's who are recipients, and then they have subrecipients who implement and actually deliver the direct patient care. I'm gonna actually, I might put my HRSA PO on the spot. I know Chris is here.
Yeah, I'm here.
If you
Can you
want
hear
to
me?
chime in on that
Thank you.
definition, the way I was describing it for the purpose of the collaborative for the question we're asking right now.
Yeah, can you hear me?
Yep, can.
Okay,
Loud and clear.
excellent. So, parts A, B, C, and D can be direct recipients. So that means you receive money from or funding from HAB directly, your organization does. Some of those organizations, again, parts A, B, C, and D, could also have subrecipients. So you receive the funding, and then you turn around and you fund an organization to actually provide some of those services, whether they be core services or support services. So what we did was we took a look at both we took a look at all parts A through D and tried to identify both recipients and subrecipients so we could have a good mix of both recipients and subrecipients across all parts to be participating in the collaborative. Hopefully that helps you out a little bit.
Thank you.
Chris, do you want to just very quickly introduce who you are to
Oh
everyone?
yeah, absolutely. So you guys will see me around. I know quite a few of the faces. Neil's always good to see you, my friend. My name is actually my first name is Ronald, but I never ever use that name. So if you see emails from Ronald Redwood, that's me. I go by Chris. I've been with the HIV/AIDS Bureau as a nurse consultant for a little over 8 years, and I've had the pleasure of being the HAB project officer for CQII for close to 4 years now. So this is my second go round with a collaborative from start to finish. I was involved in the Impact Now. So I'm the guy behind the scenes that works in the federal government, that works alongside CQII's team. I touch bases with their coaches and their faculty throughout the time as well, and we make sure that we keep the train moving in the right direction. And who you will also see on these calls, I see that Erica just came on, Erica Johnson. We have many of our, and I see Melissa Burton. We have many of our HAB POs. And we're really enjoying this because we're really trying to get our POs, our project officers, involved in the collaborative, not directly sitting with you all, but peripherally, so they will be and CQII will tell you what their roles and responsibilities will be. But this is the essence of really developing that culture of quality, not only amongst our recipients and your subrecipients, but within our organization, the HIV/AIDS Bureau as well. Kim Brown is another one of our project officers. Thank you all very much for joining. That's what I got, Megan.
Thank you. Appreciate it. Great pitch.
I see
Megan,
Amelia has,
we have a hand raised.
yeah, I see Amelia has her hand up.
Hi, Andrea. In response to your question, I should share with the group that I'm both a Part C and D recipient and a Part A subrecipient. And our Part A recipient is participating along with us. And I think how we could mutually benefit as both a recipient and a subrecipient is that when the Part A office is looking at implementing QI initiative jurisdiction-wide, that they work along with us so that we're not doing too many different improvement projects, but they see the benefit of what we will be doing in this collaborative. And then if they're going to do anything jurisdiction-wide, it would get tied in to this collaborative.
Thanks, Amelia. That is a great point. Thank you for bringing that up. That's definitely our vision as well. I see Vivian also put in the chat, so just want to make sure that gets some attention, that recipients being visible during the collaborative was vital in the last collaborative that their organization participated in. It was a great way to facilitate and support and remove barriers to success that may have presented. And Lori, thank you for putting your definition of recipients in the chat again for folks who like to read rather than listen. That was super helpful. So thanks. We really appreciate it. This is great. This is a great kind of engagement. This is what we love to see in this space, right? We don't want to talk at you. We want to hear from you. So just on that point, we know that some of y'all are recipients who are direct implementers. So you might not have a recipient that you would like to talk about needs, but also you can think about your leadership as well for this next question. So I'll pop it in the chat as well. But in what ways do y'all feel that you want to be supported by your leadership in general? So maybe not a recipient, subrecipient thing specifically. Anything that hasn't been said yet that you can envision as something you would like from your leadership in order to be successful? Right, we've heard about data. We've heard about sort of connecting things across an area or region, other implementers. I know we have like EMAs and TGAs and all sorts of folks like that. Anything else that comes to mind?
Maybe I can get the ball rolling here. One suggestion I have for all of you to think about, I think we should invite leadership to be part of this collaborative, whether they are part of your team, whether they can join some of the sessions, whether they can just listen once a month to where your program is. I think sometimes we have to take an active step to invite them to be part of it. It doesn't mean that they have to be at every meeting or every, QI team meeting that you have, but make it a strategic. Not only it would help you to get started, maybe potentially resources. I'm thinking sometimes time and meeting space is also a resource, but also think about sustainability. This collaborative is a long-term investment in your time. And so sometimes you need leadership support to sustain your wonderful new ideas that I know will come out of this collaborative.
Thanks, Clemens. I think that's actually a great note to kind of wrap up the discussion. I know we have some slides to still get through, so I want to make sure we get through those. But thanks so much for sharing all of your ideas and experiences with us. Thanks so much, Brittany. Can you go on to the next slide? Great. And I think I'm turning it to Megan for key activities, or possibly Alana.
I think it is Alana.
There you go.
Oh, it's back to me. Key activities. So here's all the fun activities we'll be doing for this collaborative. No, here's some of the activities we want to kind of own in and bring to your attention. We will have a repository. I couldn't find the word, but it's on the screen. So join our collaborative repository. So Glass Cubes, this is where we're going to house all of the key resources, templates, any documents we want to share, any documents we want you to share with us. This is where we're going to be housing it on Glass Cubes. You're going to be uploading work there. Your coaches are going to be uploading things there for you to see. There's things there for your coaches to review. All of it will be held in Glass Cubes. Think of it as your resource space for everything collaborative-wise, everything CARE collaborative. There will be an organizational capacity assessment tool. We'll introduce that to you a little bit later on within the presentation. We want to make sure that you return that back to us by May 22nd. Again, that will be uploaded in Glass Cubes. That'll be maybe one of your first or second items that you'll be uploading into Glass Cubes. We want to make sure that you form a quality improvement team that will be attending our coaching session. We'll review the basics of who those people are, what are the effective teams, and who you should be bringing to the table before you kind of have your first one-on-one one-on-one session and group sessions with your coach. And then we want to make sure that you attend our in-person learning session. I know we've said this a few times, but our in-person learning session is where we fully kick off the collaborative. You get to meet everyone in person, see all the sites, see all your recipients, maybe meet your HRSA HAB PO in person if they're able to make it down. But these are some of the key activities we want to kind of highlight for the collaborative. Next slide. Again, this is what Glass Cubes is kind of about. It's a web-based, it is password protected, is where we will be file sharing platform. You will be invited to this Glass Cube space, post this orientation session. That way you can see some of the templates, some of the documents that we'll be talking about for this collaborative, as well how to upload them. Again, you will get an invite in the coming days. Our administrative assistant, Asia, will kind of help you get oriented with the Glass Cube site. If you didn't get it by May 15th, because we want to make sure that you all have access to this space, make sure that you just send us an email ensuring that we request access. We can also see on the back end as well who were able to log on and who was signing in. So if we recognize that some of you that we send invites to is not signing in, we'll also on the back end check, but we also ask that you let us know as well. To answer Vivian, I did see your question in the chat box. It will go to your point of contact person. So the person that you all identify as the person who the main lead, it'll go to them first, and then you will decide. I think maybe one person would be the one to kind of upload within that Glass Cube space, but it will go to your main contact person.
Just to be sure that everyone who's participating should have their own Glass Cube account. So you don't rely on your leader to access it for you. There's no limit in terms of number of participants.
Correct, Clemens. Yes. And then this slide again is just a kind of a screenshot of where some of the specific things that are housed for this collaborative. Whether or not there's the tools of your tools, timeline, and templates, your toolkit, You'll see that on the screen. Each folder is labeled and kind of numbered specifically to what the what's in the folder. So this is just a screenshot giving you an idea of the spaces within the glass cubes. Next slide. And again, here's the organizational capacity assessment tool that I mentioned. This is a space where the folder, exactly screenshot of the folder of how glass cubes look, of where you're going to go to click to kind of put that into to put your completed assessment here into glass cubes. And again, we have the link here on the screen. We ask that that is uploaded by the 22nd. Can we go on over to the next slide? Apologies. I'm getting a little distracted, the chat box a little bit. I looked over at the chat box and it caught my attention. Again, so here's a screenshot of what that organizational capacity assessment tool looks like. What we're asking for you to do is this is kind of a like it's scared, where you'll be checking off just the little activities. It should be filled out between now and May 22nd. It should be filled out by all team members. So this is a collaborative approach. So everybody that is in the decision-making space, we ask that you come together and you all kind of fill out this organizational capacity assessment. Again, it should be uploaded up into glass cubes by May 22nd. And one of the questions I know you might be asking, do we need this for our first coaching session? So before I meet with my coach, should I meet with my team and have us fill this out? No. We want you to be able to fill it out in the time that kind of works with you. Make sure that it's uploaded by the 22nd. But as you meet with your coach, if you're looking at it, or maybe your team member is looking at it and you have any questions, bring that to your coaching session. Bring it to your QI expert's attention, and they'll be able to guide you whatever questions you may have with regards to completing and filling out this assessment form. And again, Clemens kind of reiterated, just make sure you fill this out as a team. You want to make sure what's happening with regards to everyone when it comes to their quality improvement capacity knowledge. Make sure you fill it out as a team and just not have one person fill it out. And I think that's it for me. Do I turn this over to you? Go ahead, Megan.
Thanks. Could we actually go back one slide to the organizational capacity assessment? I want to slow down for a moment. Does anyone have questions about this?
Hi, I have a question about Glasscube. Just because we have a lot of firewalls in our system, IT system usually has to approve different websites that we have access to. If for whatever reason we cannot have access to Glasscube, what is an alternative?
Andrea, do you want to speak to whether other sites have had
Yeah.
issues accessing it? It's a pretty popular Microsoft platform as well, so I don't think they would, but in the event, go ahead, Andrea. I'll let you.
It might take a little time, and we're very happy to work with you and your IT department. If there really was no way, we can certainly email you whatever resources we're talking about, and you can email us things, and we can then upload them so that they're available to your coaches and your peers. But we will work with you. We know some folks have signed in using a non-work address and they were able to get it. I understand, like, we're not asking you to do that. It's up to you to figure out as an organization what you're able to access or not access. But we will certainly work with you. And just while I have the mic for a moment, we know that folks who've been involved in other CQII spaces before, other collaboratives or Learning Lab or TOT, TQL, TCB, you may have a Glass Cubes profile. You will still need to be invited to this space. Each space within Glass Cubes is separate. So you will still receive an invitation, or you will suddenly see that you have access to the space. So just to pre-answer that question, if anyone was thinking it.
Yeah,
Vivian, go ahead, Delana.
Thank
So
you
sorry.
that's okay. Thank you for mentioning that, because we do have a separate platform where we can send bulk files and items through a platform. So if for whatever reason we can't access Glasscube, if you all would be willing to work with us in sending you all information through that secure platform.
Yeah, very much so. We certainly do not, we don't want this to be a barrier to anyone participating. And I see Vivian, you can notice Vivian in the chat. And I think someone else also chimed in the chat, just comparing their organization, saying they may have had similar issues. But the bottom line, David was the other one. Sorry, thanks. We will definitely work with you for sure. Rest assured. Thanks. Back to you, Megan.
Thanks. Yeah, and sometimes the invitations to Glass Cubes that you get via email, they go to your spam folders. When I first started working here, I didn't even know what it was. So we'll prompt you all. We'll work with your coaches. And for those who know what like Google Docs might be, this is a similar repository. And I think we have some folks had a bit of a love-hate relationship with it, but it really is a great space to make sure that you can access what you need to access instead of digging through your email for things. But we're happy to share them via email and get them, you know, to you however is best. All right. Can we go to the next slide? I just want to revisit the organizational capacity assessment really quickly. So again, this is something that we're asking you all to fill out with your teams together, and it'll help us monitor your progress over time. It's fairly simple, and it can really be one of the first activities that you do as a part of the collaborative. We're asking that you all, again, we'll share this slide deck with you. It has the specific link on Glass Cubes to where you can download that together, fill it out, upload it, and then we'll review it together. All the templates and things that we ask you for, those are on Glass Cubes, and we'll send them and share them to make sure that you can access them, fill them out together, and again, upload them by the dates that we see here. Does anyone have a question about this specifically at this time? And if you have questions about this, one of our coaches is going to speak in a minute, but they can provide support for helping you fill this out. If they can't answer your questions, then CQI will chime in. Any questions before we move on? Okay, all right. We can scoot on to the next slide. Thank you, Brittany. So next we have some details about the QI coaching that you'll receive and how you'll do it. So the next slide, thank you. So this is just, again, a breakdown of some logistics for you all. So first, you know, CQI will send emails with how to access Glass Cubes by May 15th. That's the latest date that you'll receive an email from us. Right after this orientation call, we're going to begin sending some of those out. We didn't want to send them out beforehand and confuse anyone or think that you got, you know, a phishing email. So that's what we'll be doing by May 15th. If you don't receive an email from us or don't have access by May 15th, email us. We'll share a collaborative email address that we've been communicating with you all from already, but just email that address. We'll work with you, just like we were describing with Delina, to get you access. Next, CQI will email your group to introduce you to your coach in the next 2 weeks. We'll do that warm handoff. We will also coordinate a date and time for both your individual site coaching sessions and your group coaching sessions. So we will be supporting the coordination of that. And then finally, CQI will send all of the calendar invitations that you all need. So no one has to worry about that, including your coach. I see something from Deontay's here. Love-hate relationship, maybe, but don't let the digital divide become a barrier. I agree. Thank you, Deontay. I appreciate the advocacy for our Glass Cube space. All right, can you move on to our next slide? Great. Okay, I'm going to hand the mic over to one of our great coaches, Amanda. Do you want to introduce yourself and
Sure. My name's Amanda Norton. I'm a quality improvement coach and consultant, and I've been doing that for about 18 years now. And I have been working with CQII for about 4 of those years. And so I'm here to talk to you a little bit about the coaching structure. I wonder if it's not too hard, can we pull the slides down just for a second? Because I would like to, I know some of these faces look very familiar to me. I'm curious by a show of hands, who has participated in a collaborative before? So either raise your physical hand, your virtual hand. I'm just trying to get a sense of who has participated in a quality improvement collaborative before. I see Kelly. Kelly, it's great to see you again. All right, so we have I'd say a mixed bag. That's okay. So we've talked an awful lot about the what are the asks. A collaborative itself is really set up so that we design the opportunities for you to interact with each other, but it's an all teach, all learn opportunity. And so what do we mean by that? It means we're not going to come into this meeting talking at you the whole time. We are going to give you a whole lot of resources and support, and you are going to be the experts in the room. And so if we pull the slides back up, we're going to talk about what that support looks like, and then a little bit more of the specifics about what we're going to need or work on together. So as you enter this group, you will be given the opportunity to work with a handful of nationally recognized coaches. Now, there are several of us working on the project, but each of you will be assigned to 2 coaches. So if you happen to be assigned to me, it's going to be me and Katrina that are working together, and we will be your primary coaches. Now, does that mean you can't reach out to other coaches? No. Or talk to them at the learning session? No, we're not going to shun you from those others, but we will be your primary coaches. And part of that is that we are going to be holding these group cohort coaching calls. These are going to happen monthly, and they are going to be our opportunity to get as many teams as I have. I think our cohorts will be about 5 to 7 teams. We will get those cohorts of 5 to 7 teams together. We will talk about what it is that you are working on. We might do a little bit of, if there's a little confusion about something we're working on, we'll learn about that or talk about it together. But that is going to be a consistent support that will always be there for you. There will also be individual coaching. And so I'm here, I've been coaching for 18 years, which makes me feel like a dinosaur when I say that out loud. But here's the thing, some teams really want one-on-one coaching. Other teams take the concepts and run with it. And so you will always have the opportunity for one-on-one coaching. We are going to be setting up times to meet with you one-on-one. But that is something that you will have some input over how often you need us. But you will always have that group coaching, and then we will have those larger opportunities when we all come together at learning sessions. Let's go on to our next slide. So who should be showing up to these group coaching sessions? You know what is really difficult is when one person gets designated as like the sole person responsible for talking to CQII. Like that's a large load to carry. I'm looking at a couple of faces right now that I know was that person in the previous learning or in the previous collaborative. And so we want you to start out bringing as many people as possible. Who are the right people? Data managers, your patient representatives, or your people with lived experience. You will have a team lead, but you are going to want to bring these other people who are doing the work with you to these meetings. You might think about bringing administrators. So, and you will have a lot of decision around who is the right person, but I encourage you early and often, don't think it's all on your shoulders. If you're coming here today as the team manager, developing your team is one of the very first things that is important for you to do. So these are some roles that might join you on the group coaching session, but we will be there to help you think about what your team is going to look like as you develop and build that team. So let's go into the next slide. So if you want some more resources on how to build an effective QI team, if you're struggling with that, if you already have this like gut feeling you might be the designated representative and getting people to come along with you is going to be difficult, you can go into Glass Cubes. There are some documents there to help you. You can also reach out to your coach. I like to say, really QI is a team sport, right? It's not a solo endeavor. The more it turns into a solo endeavor, the higher the burnout and the less effective you are. And I am not here to give you busy work. And so we really want you to develop that team. Let's go on to the next slide. So what is another ask of you? It's kind of feels awkward at times. We've talked to you and we've got a lot of asks of you. I don't want this to be overwhelming. So in a collaborative, and for those of you who have been participating in collaboratives before, we often use what's called the storyboard. So a storyboard is a way to identify some of the key activities so that we get to know you better and so that every other team in the room can have a quick and concrete way to get to know your team better. Because it's a collaborative and we're not talking at you, your ability to know who else is in the room with you and what their site is focused on, what their biggest concerns are, is important. Your first storyboard is going to ask for some kind of basic information. So we want to know who is on your team. Did you get that data manager to support you? Do you have maybe an MA or a nurse manager also working with you? Whoever are the right people, who is your team? Then we're going to ask you to draft a name statement. So I'm going to go through a couple other things that you need to do, but know that we as coaches are going to talk through them in a lot more detail. That storyboard is going to look at a name statement. We're going to get a better sense of what your baseline data is. What are your goals for that baseline data? So a collaborative says, hey, I think we could be doing better. What do you think better looks like for you? So what is the practical and stretch goal for better? And then we're also going to ask you to begin to identify, where do we think we can get started here? So let's go on to our next slide. This storyboard for this learning session is building towards a larger storyboard. So what you're looking at now is a final storyboard. from the past collaborative. And in this version, it's more of a poster, right? So this is a large document that you leave our final in-person meeting with. It looks like a poster presentation you could bring to a conference, but each of the storyboards you complete throughout this collaborative is building towards the creation of this. Lots of teams will post it in different places at their site. They will use it for publication or presentation at conferences. And so that'll be one of your final results or final tools that you'll leave this collaborative with. Let's go on to our next slide. So as I said, the storyboard it's going to come to you in a PowerPoint template. The slides will already ask you a handful of questions. We are asking that be uploaded by May 15th. So we're giving you about 4 weeks to do that. If you get into it and you think, whoo, no way I can do that, I promise you're probably overthinking it, right? Because the slides are not asking you for a ton of information. And I think collectively and with the support of your coach, we can get you there. That's what we're here for. We are asking you to upload that into the learning session folder. It'll be under learning session 1 by the 15th when you're done with that. Let's go on to the next slide. So as I said, we are going to talk about aim statements. That might be something new to you. If you say to yourself, never heard of an aim statement before, Amanda, what are you talking about? Have you heard of SMART goals or SMART objectives? Well, if you have, same thing, right? Same diff. So we're going to ask you as a team to think about, what do we want to accomplish through the duration of this collaborative? What do we think are going to be the measures of success? You know, what do we think retention or linkage might move by? And how are we going to go about accomplishing that? If we go on to the next slide, we're also going to ask you to think about your baseline data. So why do we ask for baseline data? Here's the thing, friends. Quality improvement is not about data. For a while there in like the mid 2010s, quality improvement was just the thing. Like, oh, we need data, we're going to do QI. That's not what quality improvement is about. But we don't know if what you're doing is actually working without the data. So we're asking for the baseline data so that we have some sense of where you're starting. If you submit data and the percentages look lower than you would like them to, I promise myself and the rest of the coaches are not going to call you out or call you up and be like, your data is horrible. What are you doing here? Not going to happen, right? If your data is not where you want it to be, it means you've got lots of opportunities for improvement. So we need that baseline data just to know what is true and normal today, so we have a sense of what we're working on gaining and improving over time. Now, if we go on to the next slide, our measures that everybody is asked to report and collect are linkage to care, retention and care, and viral load suppression. We have heard in the orientation calls that not all of you are collecting this data identical, which was not surprising, right? And so we want to know the ways in which you're collecting that. We need the data to be as important and impactful to your site as possible. So we don't want you to collect it in a completely different way if that means now you can't use the data. So we're going to talk through as coaches with you to say, how are you collecting these numbers? What do they look like? If you need some help with data mapping, these are the things that you turn to your QI coaches for. But these are going to be the 3 measures. What are your current percentages around linkage, retention, and suppression? And we've got definitions for that as we see it, and then we'll talk about how you're collecting that. I'm going to pause there because sometimes data makes people like have heart palpitations. Any palpitations, any questions that are burning that you just have to ask or want to know more about? Not seeing anything in the chat, but anything that is of interest or concern to you about getting some baseline data for this storyboard. I almost also get nervous when you don't have questions about data. That gives me heart palpitations. All right, if you're still thinking about it and you're still kind of letting it soak in, I understand and respect that. Your coaches are going to be reaching out to talk about it in more detail. So if we go on to our next slide, we are going to set up, as I said, group coaching is going to be a consistent, and that'll be one of your very first interactions with us. We will be getting coaching assignments shortly. And once that happens, your coaches are going to reach out and say, okay, our first group coaching call will be at this time, or we might do some negotiating of times so that we have that opportunity to go through these slides in a lot more detail than I was able to today. Well, I wanted to set out an outline so that hopefully you know, one, this is due, but two, it's not giving me a ton of anxiety about doing it. If you are the type of person who needs to see this template immediately, it is in glass cubes. Go in there, look at it. All right. I think it will calm your anxiety, not raise your anxiety. But if you really want to see the slides immediately, please go into glass cubes and look at it. We will be setting up these group coaching calls to talk through this in more detail. And then you'll have the option for a one-on-one call. If you say, hey, Amanda, I still have a lot of questions. I'm not sure this is the right aim statement. I don't know that I can get the baseline data. We will have those opportunities as well. We're going to be in person together in about 6 weeks. And so time is of the essence for us. And so we will have that group coaching call and do the best we can to get the one-on-ones in that we need. Let's go on to our next slide. So what should you prepare? We are, as I said, going to be doing these calls. Please, right now, I think now is the good time to find friends, right? Who's going to be your quality improvement team? I say friends because we all work better with some people than others. We all know some people are interested in getting into a new quality improvement project, and some people are not or don't have the bandwidth right now. And so really thinking about who are those QI team members that are going to come with me, both who do I absolutely have to have, and who do I think would be a good addition into that group. Start looking at your baseline data. So we're looking at linkage, retention, and suppression. You know the constructs. If you were to try to think about that for your patient panel right now, what would you find? What questions would you have about that data or comments about that data? And then we are continue to kind of get your self ready for glass cubes. I will say it took me a hot second to get used to glass cubes. Now I'm used to it and ready to run. But man, is the CQI staff really good about walking you through it. And so when you have questions, do not get frustrated and quit it. This is not the thing to quiet quit. This is the time to reach out to the CQI staff and get the support you need. So that's it for me. Are there any questions before I turn it back over? All right, friends, I'm excited to get to know all of you a little bit more, but I'm going to turn it back over now.
Oh, thanks, Amanda. I think the next set of slides I will cover. Thank you. And again, as always, if you have any questions, we hopefully, Amanda, didn't scare you all away with the templates. And I see that Megan put in the chat box, it's less than 10 slides. It's only a few slides you have to fill out. But we are here to guide you through it. If you have any questions, definitely feel free to reach out, that collaborative email, pick up the phone call. Whatever you need, feel free to reach out to us. We're here to kind of support you throughout this entire journey, as Amanda mentioned. Now, what we're seeing on the screen is, I know that you all want to know, what does this mean like time-wise for me? I am wearing many hats in my organization. I'm doing a lot of things. What does this mean for me timeline? So what you see up here is just the next few months on the screen, April, May, and June. Please make sure that, this is just a resource. We don't expect you to memorize it, but just kind of a guide to so you can think through, well, how do you want to plan out your next few months in terms of your capacity and your workload that you have to do to be fully involved within this collaborative. In April, we want to make sure that you kind of attend your first coaching session, download that storyboard template and familiarize yourself with the material before your first coaching session. And if you didn't get to in first coaching session, that's okay. There's no pressure. The materials will still be going over during that first session, but you want to make sure that you kind of attend it so that you're aware and fully prepared before you enter into the in-person learning session. In May, we want to make sure that you kind of upload those drafted content into Glass Cubes. So make sure the template is in Glass Cubes, upload your organizational assessment, attend the in-person learning session. And then June, we fully kick off our 18th month marathon with your second coaching session, your second grouping session. You'll go a little more in depth in within your data, what's happening with your baseline data, talking through what are your data systems you're using, how are you pulling your data, kind of defining it. And that kind of much of that happens in June. And then in July, you'll start submitting some of your first set of data. But we all kind of want to give you just a brief overview of what to expect for the next 3 months, give or take. Any questions here? Anything in the chat box before we jump on over to my favorite part?
One question was, I think it was Vivian to ask the question, is there a way to know key players based on the agenda? In other words, if I understand you correctly, Vivian, like who do I need to bring for the collaboratives? I would say just very quickly for the virtual collaborative, because there's no limit. I think the more the merrier. invite them. It's an opportunity for folks to get up to speed on the collaborative. For the in-person meeting, there's a limit of two individuals per site, meaning per participating site. So I wanted to be sure you're going to be strategic about who you want to bring. Maybe also we have 3 in-person meetings. Maybe if you want to rotate around, but there's no recipe like who is the right person. Think strategically who is the right person, maybe to attend the first one, who can be the messenger, the champion for others within the organization. We're happy to talk that through a little bit with your coach in your first sessions. Thanks, Alana.
Hold on. Thank you, Clemens. So again, this slide is just to give you a brief overview of what to expect for the next few months as you kind of plan out attending in person, identifying your team, and seeing what are some of the tools, what are some of the assignments that I need to get done before I join in person. We can jump on over to the next slide. And I said this is my favorite part, but all the activities within this collaborative are amazing. But specifically, our learning session is May 29th and the 30th. We will be meeting in person, starting this marathon, seeing all the sites that are participating, seeing everyone in the space. I often feel like meeting everyone and seeing people, it keeps me rejuvenated to kind of restart and do the work. So we're kicking off this with an in-person learning session. As Clemens mentioned, CQI will fund up to 2 site members to attend in person. This is our way to kind of physically to help with some of that physical burden that sites may have with sending a person to our in-person learning session or sending at least 2 people. Chris, you want to go ahead before I jump on into the next part of the?
No, you can finish up the last and then I'll
Okay,
ask my
sure.
question.
All right. We ask that, if you received your welcome invite to this collaborative, that means you got a welcome invite, you came to the orientation, you received another email just giving you instructions to register for how to register for our learning session. We ask that you make sure that you complete that by April 15th. If you received their email, we ask that you complete that so that Asia, who's our administrative aide, can start emailing you and arranging your accommodations to join us in person. And again, during last one, we will be sharing the completed slides from your storyboard template so you all can kind of get to know each other and see your team composition, even get an idea of where the baseline data is, and see where you all kind of align and share and matches. Go ahead, Chris.
So a couple of questions. Number one, will have POs and or organizational leaders, whether it be the subrecipient leadership and or the subrecipient, I'm sorry, the recipient leadership for those recipient sites and or the subrecipient and associated recipient leadership be invited to attend virtually? Will that be a possibility?
Basically, your question is for the in-person meeting on the May 29th, 30th, whether there's a hybrid version available.
Yes.
We'll have to play with that a little bit. Unfortunately, we didn't. In your building, there is the opportunity.
Yes.
Because we really have an amazing audiovisual ability to really bring that in. However, it can only be for sessions that are more lecture style than necessary for breakout groups. So we have to play with that a little bit. There will be some limited ability for getting virtually everybody in. We need to think that's a little bit more.
Thanks a lot, Clemens. I
Time
appreciate that.
zones, because we started 9 a.m. in the morning, that means it's 6 a.m. on the West Coast. So that's probably a session a little harder for other ones to meet.
Totally understood. And I do understand, well, you all do understand that all federal government employees are now in the building. So I would love to open it up to our HAB POs if possible. Thank you.
I just want to chime in very quickly and mention, thanks, Alana, that we will record the sessions in the main room. We record the virtual as well as the in-person learning session. So for folks who are not able to attend, or if there isn't the capacity to do a live real-time hybrid version, they will have access to the content that we record after the fact.
Thanks, Andrea. And then the next few slides, it's again, just if we can go to the next slide, Brittany, again, we're just reiterating that storyboard template section 1, make sure that gets uploaded into Glassview by May 15th. Again, if you have any questions, feel free to reach out, but you will be talking through it a little bit with your coaches, as Amanda mentioned. We can go over to the next slide as well. Now, we are, we are at 4:17. Want to make sure that we get everything in, but we also want to check in with you all. How are you feeling? Drop it in the chat box. Are you holding your head screaming because we gave too much information? Are you stressed? Are you happy? Are you excited? Let us know. Drop that emoji in the chat box. We would love to see how you're feeling. Because the next thing we're going to jump into is reporting, how we report that data, and affinity groups. Woohoo! I see some people are excited birthday hats. Michelle, I'm going to turn the next set of slides over to you as everyone shares what's happening. Share how they're feeling within the chat box.
Okay, hi everyone. My name is Michelle Pendle. I use she, her pronouns, and I'm a program assistant with CQII. Next slide, please. So for the collaborative, we'll be reporting the performance measures, specifically linkage, retention, and viral suppression every other month via an online database. If you've participated in a collaborative with us before, it's the same database setup. So if anyone would like to share their experiences in the chat with how submitting data went for you in the past, please do. Next slide. These are the data submission dates. Our first one is on July 21st, and they'll be every other month, but we'll send out reminders to you in advance of each due date, as well as reminders about what the 12-month measurement periods are, so you don't need to memorize this. Next slide. And since numbers are only half of the journey, we'll also be having quarterly reflection sessions where we will give you the opportunity to provide more feedback on how the collaborative's going and also how your improvement journeys are going outside of just the numbers. And now I'll pass it over to Kamisha.
Thank you, Michelle. So it talks a lot about different aspects of the collaborative, and just here's one other aspect that we'll briefly touch on. And again, you will learn more about this as you go forward. As noted earlier, we don't expect you to remember all the things, and we will share as much info as possible in follow-ups. And again, feel free to reach out. So another aspect of the collaborative will be affinity group spaces. And because there's so much content and so many different layers to this, we want to make sure that everyone on all levels is aware of what's happening in this project. So we have a community liaison group, and we'll also have a patient affinity group space. And this is where we continue to promote and encourage, not only encourage the involvement of patients and clients, but also to be sure that the work is continuing to be done at all levels and that they're staying abreast of what's happening, they're in the know, the capacity building, all these things. And I'll go into a little bit more what each of these groups will, the makeup of each of these groups on the next slide. But the other affinity groups are the leadership affinity group calls, where we will invite individuals that are not actively part of the project. It could be your boss, it could be your boss's boss, just someone else in leadership that will be able to come into these calls and get an understanding, get updates, and hear what's happening in the space. What has Vivian been working on these past 6 months? And they'll be able to check in and know what it is that's happening. We also have project officer calls where we'll be able to bring our project officers for your respective sites together to again bring them up to speed, have an understanding of what you are doing in this collaborative space. And then Michelle just talks about the data. We'll have a data call as well to talk through expectations. We'll be talking about reminders about upcoming data submissions and things of that nature. So this slide kind of goes into, I won't read all the bullets, goes into what some of what's the scope and who should be a part of the different spaces, and then the frequency. So I'll just go through the who a little bit, the focus a little bit, and then we'll just let it sit there for a little bit if you want to skim through. So the patient and affinity group, like I said, they will meet before and after the learning session. This is a space for people with HIV to come in, to build capacity, to get an understanding as we have them engaged in this collaborative. We want to make sure that they are fully grasping all of the content. So this is a space for us to be able to bring them up to speed before and after the learning sessions. The community liaison affinity space, this is for the individuals at your sites that will be tasked with implementing these engagement and involvement activities. So we'll bring them together once per action period, and we'll talk about what that is in the coming slide. And I talked about on the previous slide, the leadership, HRSA project office, and the data. The data affinity group, we invite you to have your data person come to these sessions and others as you see fit, but particularly those data managers. The next slide, please. And so this slide talks about the frequency of when these groups will be meeting, or the first date, excuse me, the first date of when these groups will be meeting. So we're going to have our learning session, as Alana noted, at the end of May, and the first groups will begin to meet in June. We'll start to send out invitations to who will be part of this space. It won't be everyone on the call. You will identify and let us know who from your team will be involved and engaged in these event spaces, particularly the leadership, the data, and then the patient affinity group spaces. And we will send out those invitations and have them join us with the frequency being noted on the previous slide. So it will either be quarterly or at least once per action period. And we'll talk about what that action. An action period is essentially the time frame between learning sessions. So learning session 1 is in May, 2 is in October. So we'll meet with our community liaisons at least once in between there. So that's why theirs is not listed as quarterly or monthly as the others are noted. Again, these are just other spaces where we can have everyone brought up to speed, being able to share information across the different levels within your agencies and across communities. So again, I know it's a lot, but we'll definitely give more information about these as we send out our updates and our follow-ups so that you can be able to let us know who will be a part of the space. And you'll absolutely have that conversation with your coach as far as team composition to be able to identify who these individuals are and then share your contact information with us at CQII. And again, if you have any questions, feel free, don't hesitate to reach out and let us know. I'll turn that back over to our next presenter, who will be.
And then Lori mentioned in the chat box that the affinity groups will be virtual.
Yes, all the affinity groups are virtual. And you'll get reminders, calendar invites for when they will be meeting.
Great. Okay. I think, oh, sorry, Lana. Do you mind if we wrap up really quickly? Anybody else wanted to chime in? Sorry, I heard a voice. Okay, so I'm cognizant that it is 4:25 and I want to leave some time for comments or questions. Just very quickly, if you want to scroll through these, I think we've hit you over the head with glass cubes by this point, so we hope that you know what it is. But we'll have a toolkit with everything that we use in the collaborative uploaded to that space, as well as all of the templates that we've just mentioned. Go ahead. Thanks. Next steps, again, the organizational capacity assessment to fill out with your teams. That's due by the 22nd. Feel free to upload it anytime before then. Next slide. Your storyboard template, your coaches want to review that before learning session 1 at the end of May, which is why we ask you to upload that by May 15th. Next slide. Okay, quick quiz. What did we just say? A draft is due by May 15th. Does anybody want to chime in very quickly? No one?
Is it the storyboard?
Delantace, thank you. What a star student. Okay, next one. Oh, I see Kylie in the group chat as well. Killed it. Okay, you can go to the next slide. Exactly. Your storyboard templates are due are up to upload by May 15th. Okay. What about what's due by May 22nd? What tool?
Organizational assessment.
Yes, Juliet. Beautiful. Okay, thank you all. Again, upload it anytime before then if you'd like. Next slide. Okay, just again, CQI will be sending emails for glass cubes, your coaching groups, and we'll be coordinating all of the meetings on behalf of the coaches and you all and sending out calendar invitations imminently. Next slide. And if you have any questions, feel free to reach out to myself, to Alana, but if you just have a general question, don't know where to direct it, that's the email address to reach out to, and that's the one that we've been communicating with you all up to this point. Okay, with 4 minutes left, do we have we can take down the slides now. Do you have any comments or questions? Nothing?
Can I share one wisdom I learned from the last collaborative, Megan? The one is that, and I'm buying time for others to chime in here for if you have other questions, but I think one lesson learned from the last collabs was the more you put in, the more you invest your own time, the more you get out. These collaboratives, you can go just low burning, and everybody will be happy. But the more you invest, the more time, the more people you bring to the table, the more you will get you benefit out of it. And so take advantage of it. Send Megan an email, reach out to the coaches, ask our peer coaches. We're here to help you. If you don't ask us the question, is sometimes harder to help you, but take advantage of the resources that are made available to you.
All right, with 3 minutes left, how is anyone feeling? Excited? I know we dropped in emojis in the group chat, but is anyone really overwhelmed? It's okay.
I
Maybe
have a
we can
question.
have.
Oh,
Go
we have a
ahead.
question. Okay.
I have a question. Is the session today and the session that's scheduled for
The
April the
23rd.
23rd, is this the same session?
Yeah, so
Okay.
you do not need to attend again. Yeah.
Okay, thank
We
you.
won't put you through that twice.
Thank you. I love to see all of you all, but
Yes, yes.
I
You'll
have
see
a
plenty of us, I promise. Yeah.
okay, thank you.
Great to see you though, Pamela. Welcome back.
Thanks.
Do any one of the coaches want to say anything before we let everyone go? Or want to mention any of their experiences very quickly?
I would just say welcome. I said in the chat it was the metrics with the how many people involved, viral suppression to the actual expense. Oftentimes I think about, oh, actually, let me not ramble because we only have 2 minutes. I'm sure other people want to say things. But I'm very excited. I don't know what you guys are getting, but I'm excited. I'm excited.
All right. Thank you, Deontay. Appreciate it. We love the enthusiasm.
Maybe if I know we have some repeat offenders, and I don't mean to call you all that, but who have been in learning collaboratives before, but maybe if they want to share some words of wisdom to some of the new people who have never been in a learning collaborative. I know I saw Kelly on the screen, Andrea. If there's maybe words of wisdom they want to share for our some of the new folks joining us.
I can definitely respond to that shout out. As a repeat offender, I would say the Impact Now Collaborative was my first time joining any collaborative with CQII, and I joined halfway through. So it's definitely something for those new members. Don't be afraid to try and try again. I know our site went through multiple cycles and we were like, we're failing. We thought we were failing, but then it's like, no, each time that you think that you fail, you're learning. And so always being kind to yourself to remember that of, hey, there's no right or wrong, and most definitely steal from the other sites. When we're all together, make sure, hey, if there's something going on in a different state, your similar state, don't be afraid to steal. Steal shamelessly is what we love to do.
Can we maybe also call on Justine Davenport? I see you too. Do you want to maybe say something?
Just take it one step at a time. Impact Now was also my first collaborative, and it was very overwhelming for me, not being I won't say a pro, but having no knowledge of quality improvement. So I would just say take it one step at a time. It will work out in the end. Trust the process. You are not alone. So if you have questions, the coaches are great at answering them. Happy to be back.
Yay, we're so happy to have you.
Welcome
Right.
back, Justine.
Yeah. All right, everyone, it is 4:30 on the nose. Thank you all so much for your time and attention for 90 minutes. We know it's difficult. Coaches, thank you for coming, contributing. You'll hear from us soon. Thank you so much for coming. Great to see
Have a
you.
great week, everyone.
Thanks. Be well.
Bye, everyone. Well, CQII will stick around if anyone has a question that they didn't want to ask in the group. We're here.